Services at public hospitals across the island were affected today by a strike action commenced by nursing staff. Our reporters across the island say that patients who came to the hospitals to receive treatment were severely inconvenienced as a result. The strike action continued today after discussions held yesterday with the Minister of Health and midwives ended without a resolution for the long-standing conflict between nurses and midwives over labour room training being given to nurses.
The conflict arose when nurses entered hospitals for labour room training after they were given a satisfactory resolution to their demand for labour room training. Midwives and doctors did not respond positively to the decision to provide labour room training to nurses. The strike action that is now in effect island-wide based on this issue has the support of both the Government Nursing Officers Association and the Public Service United Nurses Union. Nurses Union say that the De Zoisa Hospital in Colombo, the Lady Ridgeway Children's Hospital, the Castle Street Hospital and the Maharagama Cancer Hospital have been accepted from the strike action. Numerous patients had been arriving at the outpatients department of the Colombo National Hospital since before 9 o'clock this morning.
They have not given the token as yet. We have travelled very far to get here. Patients are severely inconvenienced.
මෙතන ඔපරේෂන් කරලා එක්කෙනෙක් ඉන්නවා ඒකට ක්ලිනික් එකෙවිල්ලා ඒක ගලව ගන්න බැරි ඒක මේ කොච්චර දෙනෙක් එහෙම ඉන්නද කට්ටිය.
The OPD was opened by the director of the hospital owing to the nurses' strike action. Our cameras also captured footage of closed rooms with padlocked doors that are usually left open. Hospital director Dr. Anil Jar Singh visited the wards and inspected operations. Doctors at the accident ward continued to examine patients while minor staff at the hospital also assisted in the process. Even hospital security assisted in providing treatment to the patients.
This is a patient at the accident ward of the Colombo National Hospital. Many patients like him are severely inconvenienced due to the strike action.
දැන් මේ ඊයේ ඉඳලා මේ ගෙනල්ලා බලාගෙන ඉන්නවා බෙහෙත් කරගන්න විදිහක් නැහැ. බෙහෙත් පැත්තේ දෙන්න සේලයින් එකක් පුරවන්න කිසිම කෙනෙක් නැහැ.
The strike action also affected the Kurunagala Teaching Hospital with patients at the renal units being transferred to the Kandy and Anuradhapura hospitals.
It is the nurses who have been trained to use the transfusion unit, so in order to save the lives of patients in critical condition, we have transferred them to the Kandy and Anuradhapura teaching hospitals.
Meanwhile, patients in certain wards of the hospital who had received treatment for their ailments were discharged by the doctors today.
The doctors did everything. The minor staff also assisted. They did the job far better than it would have been done if the nurses were here.
Our reporter says that the doctors, midwives and minor staff together carried out the functions of the hospital. However, he added that the usual hustle and bustle could not be witnessed at the Kurunagala Teaching Hospital today. Nursing staff at the Kandy General Hospital are only carrying out essential services as a result of the strike action. Other services were being carried out by doctors and minor staff. Hospital authorities say that the functions of the Karapitia Teaching Hospital in Galle, the largest of its kind in the southern province, were severely affected by the strike. They say that although midwives have reported to work at other hospitals, they have not done so at the Karapitia Teaching Hospital, making the situation much more grievous. This footage was captured by a camera at the Anuradhapura Teaching Hospital, where the nurses' strike was in effect. Nurses only carried out services in the emergency unit.
Although the nurses are on strike, we are on duty in our wards along with the minor staff and the midwives.
The functions of the Polonnaruwa General Hospital were severely affected by the strike action, with close to 400 nurses attached to the hospital participating in the strike. Doctors carried out services with the assistance of minor staff here too. Our reporter says that nurses are only carrying out essential services. We captured footage of how nurses attached to the hospitals had confined themselves to the hostels. The director of the Mathura General Hospital said that nurses had informed her in writing that they are prepared to report to work at any moment if they are called upon.
Patients are being treated with the assistance of the doctors and junior staff. The OPD is also functional. We treated almost all the patients who came to the OPD. We also treated all the patients who are receiving in-house treatment. Let's now take a look at the views expressed by various stakeholders on the prevailing situation.
The Public Service United Nurses Union did not commence a strike action regarding this matter at any time, but today we had to signal our protest because the doctors have got together and established an unofficial ministry within the Ministry of Health.
The strike action is being conducted successfully at close to 650 hospitals across the island. If any hospital director calls in tonight and says that hospital functions were carried out as usual, it is a lie.
The majority of hospitals in Sri Lanka are functioning successfully without the nurses. It is not the nursing service that has collapsed, but the other activities that were carried out by the nurses. For example, admitting patients to the ward. This is work that is conducted by nurses who think that it is within the ambit of their duties. In truth, it is the duties of others that have broken down.
Today they have locked all the medicines in the cupboards and have left with no consideration whatsoever. The people must now take a decision on the nursing service, which at this moment is prepared to sacrifice lives.
The drug cupboards are usually closed, and during a strike they are closed anyway. It is closed and the keys to the padlocks have been entrusted to the directors of the hospitals. Not a single nurse has kept the keys. Keys have been entrusted to all hospitals.
Surgical equipment has been hidden away and they have handed over false keys to the operation theatres, not the real keys. They have switched around some types of drugs. These nurses have fallen to the low level of even switching the labels on medicine bottles. They are lying and breaking the padlocks. They cannot resolve the crisis. They have artificially created in the health sector by showing it to the country through the media. It is not they, but the people of this country that are the owners of the health service. We will not leave room for patients' lives to come to any harm. If a certain person engages in a strike action without carrying out emergency services in the health sector, that is equated to murder. The Minister of Health, the Health Secretary and Director are passing the ball around without taking a decision on this. They have delayed for 3 months now. Therefore, we were made to resort to this action because if the Ministry of Health persistently fails to resolve this issue, then the only action we can take is to protest. I respectfully call upon the nurses' unions. How much has this government given you under the patronage of His Excellency the President? Therefore, give us space to discuss and resolve this issue, and please move to stop this trade union action. That is my final request. At this moment, we are forcing them to resolve this problem and take the middle ground. If they take a decision tonight, we are prepared to halt the strike at any time of the night.
අපි ඕන වෙලාවක සාකච්ඡා කරන්න ලෑස්ති සාකච්ඡා කරලා විසඳ ගන්න පුළුවන් කියලා හිතනවා. ඒ සමිති නායකයින්ට වගේම හෙද සේවයේ ඉන්න හැම කෙනෙකුට
We are prepared to discuss and resolve this problem at any time. Just like the leaders of the trade unions and everyone in the nursing service, we all have a heart. We believe that everyone will act humanely at this instance and think as human beings to understand this situation and commit themselves to saving people's lives.
ජීවිත වෙනුවෙන් කැප වෙයි කියලා.